My presentation today is about anthropometric analysis of beautiful upper eyelid. The face is the most expressive part of the human body. One of the key focal points of facial aesthetics is the periocular regions. Upper eyelid surgery is one of the most common cosmetic surgery. Beautiful upper eyelids make one feel more attractive and confident. The ideal beautiful eyelids is difficult to define because the ideal beautiful eyes is not a single type but a branch of spectrum. In the past, the goal of Asian eyelid surgery was a Caucasian look. However, a natural upper eyelids on the Oriental face are conserved. Then the trend shifted toward unique, beautiful, natural-looking eyelids. Compared to Caucasian face, the Asian face is generally known to be characterized by greater intercanthal width, epicanthal folds, smaller eye-fissure length, and hooding of the upper eyelid creating a puffy eyelid appearance. Approximately 50% of East and Southeast Asian women are born with a minimal or absent subclavicular eyelid frizz. The feature may contribute to what they perceive as an aesthetically undesirable appearance and encourage them to seek double eyelid surgery. In 1896, Mikamo, a Japanese physician, reported the first case of an eyelid procedure to make the Japanese eyelid more attractive. Mikamo double eyelid operations is a method to reduce a second palpebral fold in some Japanese eyelids. Using tender tear technique, a line is marked on the eyelid at the side of the desired double eyelid fold in the midline of 6 to 8 mm from the lip margins. 3 sutures approximately 3 mm apart are then applied along this line. Since then, many publications on various techniques were reported. For example, new technique combined with suture and instance method for creating a more physiologically natural double eyelid by Byung-Chul or transcutaneous, subcutaneous, and intratarsal suturing procedure in double eyelid surgery by Xiaowei-Lin. Or a nucleus fixation technique for double eyelid plasty using mini-lab derived from restaural levator tissue in 2010 by Yu Choi. The question is what is the most beautiful upper eyelid and how to analyze and quantify the characteristics and parameters of the eyelid. Quantifying the characteristics of the aesthetically pleasing eyes is fundamental to achieve reproducible surgeons and non-surgeon results. Hence, correlating the parameter to subjective attractiveness of the periorbita will enable surgeons to set quantitative goals for surgeons and improve communications with patients regarding outcomes. A study of Emma McDonald in 2020 analyzed and quantified the characteristics and parameters of eyelids and athnasia of males and females including Asian eyelids and correlates the findings to an aesthetically pleasing score. Measurements of 10 word margin to reflex distance 1, MRD1, vertical palpebral fissure, PF, inferior glial show, ISS, tarsal platform show, TPS, and brow fastband, PFS. Traditionally, the upper eyelid has been evaluated with MRD1 and PF, and ISS have been used to evaluate lower eyelid position. More recently, the role of TPS and PFS symmetry have been highlighted in microthoracic surgery during upper lephaloplasty, eyelid retraction repair, and non-surgeon management of periocular aesthetics. MRD1 is defined as the distance from the corneal light reflex to the upper eyelid margins. Palpebral fissure is defined as the distance from the inferior eyelid margin to the superior eyelid margin. ISS is defined as the distance from the inferior limbus to the inferior eyelid margins. TPS is defined as the distance from the upper eyelid margin to the upper eyelid fold. and PPS is defined as the distance from the center of the anatomical brow to the upper eyelid fold. Participant photographs were brought to include only the right eye of each participant in an unidentifiable manner and incorporated into an online survey with the same questions. Please rate the aesthetic appeal of this right eye. The answer choices provided correlate to a 5-point scale. 5 is very good, 4 is good, 3 is neutral, 2 is bad, and 1 is very bad. The score of the male and female group were averaged, which was set as the value to divide the eyes into less and more aesthetically pleasing groups. Figure A is photograph of the more aesthetically pleasing eyelid, and Figure B is a less aesthetically pleasing eyelid, illustrating the lack of inferior glical show, less tarsal platform show, and lower brow fat span. The results show that the parameter between the two male groups were not statistically significant, and the parameter between the two female groups that were statistically significant were ISS and TPS. Also, there was a statistically significant correlation between ISS and aesthetic score, along with TPS and aesthetic score. Besides, the ratio of PFS and TPS was also not significantly different between the two female groups, but trended toward higher value among the more aesthetic groups. Overall, beauty and attractiveness were subjective and were comprised of numerous variables. In the male arm of this study, there was no correlation between eyelid parameter and aesthetic appeal, suggesting the periorbital may play a more limited role in male attractiveness than other facial and body attributes. Analysis of the female cohort did reveal some identifiable trends in what was perceived as aesthetically pleasing in regard to periorbital. The more aesthetic female has significantly less ISS and TPS and tended to have a greater MRD1 and PFS and TPS ratio. A study of Kara Purusabat in 2020 aimed to define the most beautiful upper eyelid in Oriental, especially in Thailand. For data collection, 12 parameters were made. 1 is horizontal distance of barrel fissure. 2 is vertical distance of barrel fissure. 3 is the height of the open upper eyelid. 4 is height of double fold. 5 height of double fold to lower margins of eyebrow. 6 the intercanthal distance. 7 the interpupillary distance. 8 the height of eyelid crease to lower margins of eyebrow. 9 is height of eyelid crease. 10 is height of glow upper eyelid. 11 is height of tarsal blade. And 12 is height of epicanthus. About epicanthus types, there are 4 types of epicanthus, which are epicanthus supraciliaris, epicanthus tarsalis, epicanthus barbogralis, and epicanthus inversus. The data were divided into 3 groups. Group A is the most beautiful upper eyelid. Group B is average beautiful upper eyelid. And Group C is less beautiful upper eyelid by the point of view of plastic surgeons and beauty contestant winners. The photographs of natural eye opening were categorized into 3 groups by 3 independent plastic surgeons and 3 independent beauty contestant winners. Each plastic surgeons and beauty contestant winners scored a scale of double eyelid from the photograph of natural eye opening to rate attractiveness of each photograph in the visual analog scale from 1 to 10. This study showed the mean vertical parallel height in Asians with double eyelids was 9.07 mm in males and 9.08 in females. However, the beautiful group demonstrated higher vertical parallel height than average and the less beautiful double eyelid group. Interestingly, the mean vertical height in the beautiful group is similar to that in the Western populations. Also, the mean height of the double fold during open eyelid was 1.33 mm in males and 1.52 in females. However, the beautiful eyelid group saw a higher height of the double eyelid fold than the average, and the less beautiful group in both males and females. The study also revealed that the double eyelid when open should be higher than 2.14 and 2.35 mm in males and females for beautiful double eyelid respectively. The study showed mean eyelid raises were 5.05 in female and 5.71 mm in females. However, the beautiful group saw a higher eyelid crease than average and from the less beautiful group in both male and females. The eyelid creases should be higher than 6.09 and 6.65 mm in males and females for beautiful double eyelids respectively. The concept in double eyelid surgeons in Oriental are controversial. The eyelid crease should not be laid higher than the superior border of the tarsal plate because it will decrease the contractility of the levator muscle. In addition, a high crease can look unnatural. Most Asian epicanthal folds can be categorized as an epicanthal tartoclis variant. It is a normal anatomic entity unique to the Asian patient populations and is not considered a deformity. The epicanthus would occur in approximately 45 to 51% of Asian male subjects and 49 to 62% of Asian female subjects. The most common type of epicanthal fold in these studies was epicanthal tartoclis in males and epicanthal parabolalis in the female group. However, epicanthal subrachiotic iris was the most common in the most beautiful upper eyelid group. The ratio between height of the upper margins of the double fold to the lower margins of the eyebrow and height of the eyelid crease during eye closure was calculated from the most beautiful upper eyelid group in the point of view of plastic surgeons and beauty contestant winners, and so approximately 1.2 to 1. The data from this study were applied to perform double eyelid surgery as shown on the picture on the right. However, the results may be affected by the levator functions, eyebrow process, prominence of the subbrow orbital grin, fullness of the upper eyelid, the full facial proportions, the facial designs, and expectations. Furthermore, this ratio may not be reliable in patients with too high or too low height of the upper eyelid margin to eyebrows. The study showed that the most beautiful double upper eyelid in the Oriental demonstrated a higher vertical palpebral fissure, double eyelid fold, and height of the eyelid crease than average and the less beautiful double upper eyelids. With the advent of high-resolution 3D photogrammetry, it has become possible to overcome some obstacle caused by patient movement, reduce inter-observer variability, and provide attractive measures for surface information of soft tissues. In this study, detailed aromometric values were obtained using 3D photogrammetry to determine factors contributing to attractive eyes. The purpose of this study was to investigate the differences in the periorbital aromometry between nasal beauty pageant contestants and ordinary young women in current ethnicity. 91 women, including 48 ordinary young women and 43 beauty pageant contestants. 3D photographs of all selected subjects were captured by one of the authors. The scannings were performed under the same brightness and were shot 3 times in frontal, left, and right, or reach views, After 3D facial image was reconstructed by merging the images, the entire scan image was reoriented automatically. Landmarks used for facial analysis are alar, papilla superior, pupil, papilla inferior, exocantons, endocantons, junction, medial end of eyebrow, lateral end of eyebrow, and apex of eyebrow. 9 linear, 1 angular measurements, and 7 facial proportions were computed automatically from the identified landmark. The parameters include horizontal dimensions of the papilla fissure, vertical dimension of the papilla fissure, interpupillary distance, binocular width, intercanthal width, nasal width, the midfacial width, and slant of the papilla fissure. The height of the upper eyelid and width of the retardal grid were measured. The incidence of the double fold and tight epicanthal fold were also investigated. Facial proportions, including the ratio between the interpupillary distance and the midfacial width, the ratio between the nasal width and the intercanthal distance, the ratio between the midfacial width and the horizontal dimensions of the papilla fissure, the ratio between the intercanthal width and the horizontal distance of the papilla fissure, the ratio between the upper eyelid height and the width of the retardal grid, the ratio between the upper eyelid height and the vertical dimension of the papilla fissure, and the ratio between the horizontal and vertical dimensions of the papilla fissure were obtained from the measured values. The parameters for the shape of the eyebrow are brow apex angle, brow slant angle, horizontal radius of brow apex, the vertical radius of brow positions. This study reported slightly higher papilla fissure blends in beauty pageant contestants compared to that in ordinary young women, approximately 28 versus 26.1 mm. Rather, the relatively narrow appearance in the papilla fissure blends could be explained by the presence of the epicanthal fold. It is notable that the type epicanthal fold was not evenly distributed in the two groups. Epicanthal tusculate and epicanthal supraciliaris were the only type present in beauty pageant contestants, while epicanthal papillones and epicanthal inversus were only found in the ordinary young women. Other epicanthal folds create an obtuse angle in the medial canthus, which may affect the horizontal measurements of the papilla fissure blend. In this study, the mean value of approximately 8 to 10 degrees of papilla slant was identified in both groups. 8 to 10 degrees of papilla slant is acceptable not only as normal but attractive, which can be referable values when lateral controversy is planned in young females. A higher ratio was found in beauty pageant contestants than in ordinary young women, 42.1 versus 41.7%, although not statistically significant. Given the fact that beauty pageant contestants have narrow faces but relative contents interpupillary distances, while horizontal ratio among intercanthals with papilla fissure width, horizontal dimensions, and facial width, mid-facial width, uninteresting proportions were found in beauty pageant contestants. On the basis of papilla fissure width, intercanthal width and facial width were 1.2-fold and 5.2-fold longer respectively. Also in 1977, some declared the rule of horizontal fifth when portraying the ideal face. This study suggested the modified reference for Korean females whose intercanthal width is relatively wider owing to the ethnic characteristic. In ordinary young women's intercanthal width and facial width were relatively larger, 1.4-fold and 5.6-fold longer on the basis of the papilla fissure width. Regarding the ideal ratio of the horizontal and vertical dimensions of the peripheral fissure, the results show that the horizontal dimensions were 2.4 plus minus 0.2 times the length of the vertical dimension in beauty pageant contestants, whereas 3.7 plus minus 0.8 times in ordinary young women. Also, the ratio of the upper eyelid height and vertical dimension of the peripheral fissure show the same value in beauty pageant contestants, whereas the upper eyelid height was 1.5 times longer than the vertical dimension of the peripheral fissure in ordinary young women. From the results, an ideal ratio of the attractive eye was suggested to be 2.4 times the aspect ratio in peripheral fissure width and height, and the same proportions of upper eyelid and peripheral fissure height. Regarding the shape and the position of the eyebrow, beauty pageant contestants have a consistent brow apex angle, ranging from 20 to 28 degrees, whereas ordinary young women have a wide range of variation of brow apex angle. The slant of the eyebrow was nearly zero in beauty pageant contestants, suggesting that the lateral end of the eyebrow lie at the same horizontal or slightly caudal to the medial end of the eyebrow. The vertical ratio between eyebrow height and forehead height was approximately 2.2 in beauty pageant contestants, which suggests that the ideal position of the brow lie in the lower one-third of the vertical reference line, from the pupil to the hairline. From this study, attractive women tend to have wide-set eyes, the larger peripheral fissure in the vertical and horizontal dimensions, relatively small upper eyelid height and intercanthal width, and a relatively small nose and facial width. For conclusions of the concept of facial attractiveness is constantly evolving with time. Aesthetic lattice surgeons should follow the recent trends and produce a face that is close to the prototype for the population being operated on. There is no absolute criterion for attractive faces, but understanding the difference between attractive and normal faces will facilitate individualized surgical planning. Thank you for listening.